HESI A2 Exam Prep in USA. Question 1. Urticaria is the medical term for Option A, eczema. Option B, hives. Option C, psoriasis. Option D, acne. The correct answer is Option B, hives. Question 2. Which is a run-on sentence? Option A. The patient was tired, but she refused to rest. Option B. The patient was tired, she refused to rest. Option C. Because the patient was tired, she refused to rest. Option D. The patient was tired, however, she refused to rest. The correct answer is Option B. The patient was tired, she refused to rest. Question 3. Which organelle is responsible for producing ATP energy? Option A, nucleus. Option B, a ribosome. Option C, mitochondrion. Option D, Golgi apparatus. The correct answer is Option C, mitochondrion. Question 4. A moving object has momentum. Momentum equals Option A, mass times velocity. Option B, mass times acceleration. Option C, 1/2 mass times velocity superscript 2. Option D, a force times time. The correct answer is Option A, mass times velocity. Question 5. A homozygous dominant, AA, crossed with homozygous recessive, AA, produces offspring that are Option A, all AA. Option B, all AA. Option C, all AA. Option D, 50% AA, 50% AA. The correct answer is Option C, all AA. Question 6. The image formed by a plane mirror is Option A, real and inverted. Option B, virtual and upright. Option C, real and enlarged. Option D, virtual and inverted. The correct answer is Option B, virtual and upright. Question 7. A catalyst speeds up a reaction by Option A, increasing activation energy. Option B, lowering activation energy. Option C, being consumed. Option D, changing equilibrium. The correct answer is Option B, lowering activation energy. Question 8. Passage 4. Understanding blood pressure. Blood pressure is the force of blood against artery walls. It is recorded as systolic pressure over diastolic pressure. Example, 120/80 mmHg. Systolic pressure occurs when the heart contracts, diastolic when the heart relaxes. Hypertension, or high blood pressure, is a major risk factor for heart disease and stroke. Lifestyle changes such as reducing salt intake, exercising, and managing stress can help control blood pressure. Question: which lifestyle change is not mentioned? Option A, reducing salt. Option B, exercising. Option C, increasing caffeine. Option D, managing stress. The correct answer is Option C, increasing caffeine. Question 9. Passage 1. Hand hygiene. Proper hand hygiene is the single most effective way to prevent the spread of infections in healthcare settings. Healthcare workers should wash their hands with soap and water when visibly soiled and use an alcohol-based hand rub when hands are not visibly soiled. Hand washing should occur before and after patient contact, after removing gloves, and after contact with bodily fluids. Despite its simplicity, compliance with hand hygiene protocols remains a challenge in many facilities. Question: according to the passage, when should soap and water be used? Option A, after every patient contact. Option B, when hands are visibly dirty. Option C, only before surgery. Option D, after using alcohol rub. The correct answer is Option B, when hands are visibly dirty. Question 10. Which organelle is not found in animal cells? Option A, mitochondria. Option B, nucleus. Option C, chloroplast. Option D, a ribosome. The correct answer is Option C, chloroplast. Question 11. A patient needs 40 milliequivalent KCl, supplied, 20 milliequivalent per 15 ml. How many ml? Option A, 30 ml. Option B, 20 ml. Option C, 15 ml. Option D, 40 ml. The correct answer is Option A, 30 ml. Question 12. Exacerbation of symptoms means Option A, improvement. Option B, a recurrence. Option C, worsening. Option D, onset. The correct answer is Option C, worsening. Question 13. The main function of the spleen is Option A, produce bile. Option B, filter blood and immune surveillance. Option C, store glucose. Option D, produce insulin. The correct answer is Option B, filter blood and immune surveillance. Question 14. Select the correct pronoun. The doctor instructed my colleague and blank to monitor the patient. Option A, I. Option B, me. Option C, myself. Option D, we. The correct answer is option B, me. Question 15. The atomic mass of an element is the weighted average of option A, electrons. Option B, protons. Option C, isotopic masses. Option D, neutrons. The correct answer is option C, isotopic masses. Question 16. Passage 6, Diabetes mellitus. Diabetes is a chronic condition characterized by high blood glucose levels. Type 1 diabetes results from the body's failure to produce insulin. Type 2 diabetes involves insulin resistance and often occurs in adults due to obesity and sedentary lifestyle. Symptoms include increased thirst, frequent urination, and fatigue. Management includes monitoring blood sugar, dietary changes, and medication. Uncontrolled diabetes can lead to complications like neuropathy, kidney failure, and vision loss. Question: according to the passage, type 2 diabetes is associated with option A, viral infection. Option B, obesity and sedentary lifestyle. Option C, genetic mutation only. Option D, childhood onset. The correct answer is option B, obesity and sedentary lifestyle. Question 17. The process of moving food through the esophagus is called option A, segmentation. Option B, peristalsis. Option C, mastication. Option D, defecation. The correct answer is option B, peristalsis. Question 18. The nurse, along with the doctors, blank the policy. Option A, support. Option B, supports. Option C, are supporting. Option D, have supported. The correct answer is option B, supports. Question 19. Order: infuse 750 ml over 5 hours. Drop factor equals 20 GDT/ml. Flow rate: option A, 50 GDT/min. Option B, 60 GDT/min. Option C, 30 GDT/min. Option D, 75 GDT/min. The correct answer is option A, 50 GDT/min. Question 20. In cellular respiration, the final electron acceptor is option A, glucose. Option B, carbon dioxide. Option C, oxygen. Option D, water. The correct answer is option C, oxygen.